係 Doctor Yu 聽唔聽到啊？
聽到。
OK， 好。咁你暫時 share screen 先，個 YouTube Live 就開住咗。
哦 ，share screen 先。
係啊。
OK，
我停咗先。係啦，得。
我睇點 share 先。
OK， 好。咁你暫時 share screen 先，個 YouTube Live 就開住咗。share screen 先。係。睇到啦，我編咗你先。
聽唔聽到我講嘢啊？
我睇到你個 screen， 我而家睇下點樣編你先。我開翻 participant 先。得。唔係咁樣。咦？而家冇得編，得，我不如揀呢個啦。係 make 咗 co-host， 但係都冇得編喎。點樣編你咧？好 ，Doctor 要我睇一睇 YouTube Live 嗰邊，應該冇問題，應該係你個樣嚟嘅而家。
哦 ，OK， 咁我一陣間就睇埋你，一陣間嗰個Q&A 咧，我應該睇邊個 WhatsApp group 嘅，係咪你嗰個定係 preparation 嗰個嚟嘅？
聽唔到。
一陣間我睇一個 Q&A 咧，係咪睇你身邊嗰個 WhatsApp group 定係 COVID Talk 嗰個 WhatsApp group 啊？
其實我可以喺 COVID Talk 嗰個 WhatsApp group 嗰度睇，好唔好？大家
兩個都得㗎，冇所謂。
有啲問題。
冇所謂。
係啦，好嘛。我喺 WhatsApp group 嗰度問一問，可以開始未先？
嗯。
好，咁我哋準備開始啦 ，Doctor Yu。
OK， 好啊。
Okay. Good afternoon, everybody. So this is Mandy from Hong Kong Women Doctors Association. Happy Easter Sunday, and welcome to our talk on COVID and vaccine. Today, we are very happy to invite Dr. Carol Yu, who is a specialist in internal medicine, to share with us more knowledge on the COVID-19 vaccine. And we hope this helps to solve your queries before you decide to get the injection or not decide to. So if you have any questions, please feel free to type in the chat room next to the YouTube desktop web browser. Or if you cannot find the chat box, then you can type the question in the FB page of the Mission for Migrant Workers group. At the end of the presentation, we will gather your questions and ask Dr. Yu to answer. Thank you very much. So without further ado, let me invite Dr. Yu to start the talk. Dr. Yu, please.
Thank you, Mandy. Hello, everybody. I'm very happy to see you today. Thank you so much for helping Hong Kong people while you're staying in Hong Kong. You are a very important part of Hong Kong. And so we want you to be protected from the COVID and the COVID-related problem. So today, in coming 30 minutes, we'll have a brief discussion on the COVID and the COVID vaccine. So we're having a lot of hot discussion about whether you should receive COVID vaccine or not, but it is a personal choice. If one thing that the benefit outweigh the risk, one may consider having the injection. So in coming 30 minutes, I'm going to provide you with some background information so that you can decide for you and for your friends. Before we talk about the COVID vaccine, let's talk about something about the virus first. COVID is caused by a virus called coronavirus, and it is one of the millions viruses that we can find in the world. And apart from coronavirus, you have many other viruses that we have been found before. And for coronavirus, the word corona means the crown. It describes the outlook of the virus. As you can see here, there are many dots on the surface of this virus. And these dots is actually one of the very important structure called spike protein. And these spike proteins is important for the virus to get into our body. It's just like our hands to grab on the surface of our body cells to help the virus to get into the body. Just like rock climbers, the hands is grabbing on the wall of our cells, grab on the cell wall so that the virus can go inside into our body cells. Virus itself cannot replicate. It cannot live on its own. It has to be. It has to invade into somebody in the host in order for it to replicate and multiply. And so it is why very important for this coronavirus to have this very specially designed spike protein to help to get into the cell of our body. So once the virus is attached to the cell surface, it will inject the genetic material into the body so that it will instruct the infected cells to produce its own virus. When the virus is produced, it will be ejected out of the cells and infect other people. So this is how the virus replicates itself and infect other people by going into the respiratory tracts of the host and infect the lung and many other different body organs. So fortunately, we have our immunity, which protects us from all sorts of infections. Basically, we have the immunity consists of two parts. One is innate immunity, and the other is called adaptive immunity. Innate immunity provides us with a rapid response, but non-selectively. Adaptive immunity is more specific. It is acting on a specific type of viruses and bacteria because it can develop memory and produce specific antibodies against these sort of pathogens. Whenever we have an infection, our body will remember it by producing antibody. So if we remember when we are young, we have the measles vaccine. So we inject measles vaccine into our body so that our body immune system learn about this measles and produce antibody against it. And most importantly, our immune system can be trained and memorize this infection. And when this infection and these pathogens go into our body can act immediately and more effectively. So that's how we protect ourselves against this infection by having vaccination. So we have measles vaccination in the past. We have now chickenpox vaccination. Of course, we have annual flu vaccination so that our body can be trained against this infection. But the problem is for the coronavirus, for this COVID-19 infection, this is completely new to us. Nobody have this antibody. And this is the reason why these infections cause so many people get infected and die because of this infection. So how vaccine works? Vaccine have trained our immune system, but with a harmless form of virus. It is not a real virus. It is just a dead virus or part of the virus protein particles. So this is not going to cause any infection to our body. But this vaccine activates our adaptive immune response so that our adaptive immune system, namely B cells and T cells, can recognize it, remember it, and produce antibodies against its infection. This is how vaccine works. And it has been proven that vaccine is very effective against a lot of different infections, for example, polio, influenza, and a lot of diseases has actually been eradicated in the globe because of the global vaccination program in the past 100 years. How is the risk of the COVID infection? COVID has been there for about a year, and we know that COVID is not very deadly, but of course it will cause certain mortality. Most of us, if we get infected, 80% will have mild disease. However, 14% of us will have severe disease, will have shortness of breath, and some of us will develop very severe disease, and they will develop lung failure. They are not able to breathe. They will have organ problem. The organ function may be affected, and therefore some of them will die eventually. And about 2.3% of the people infected with COVID will die eventually. So COVID can cause a number of different problems. A third of us will develop pneumonia, chest infection, and some of them will develop respiratory failure. They require machine to help them to breathe. Some of them will have kidney problem, will fail the kidney function, and some of them will have severe inflammation and sepsis. And if you look at this graph, you know that certain proportions of these patients, whether you have mild or severe disease, some of the infected population will die because of this complication. Fortunately, most of them can be covered, but a certain proportion will have a significant consequence. And therefore, it is important to help prevent this virus effectively. How about the situation in Hong Kong? In the past 1 year, the estimated overall symptomatic, I mean, those people who have symptoms and confirmed to have COVID, the overall death rate is about 1 to 2%. Not many, but a significant proportion of the people will die because of it. And some will develop complication resulting in organ failure. It is a more important problem when compared to flu and influenza. If you compare the mortality, the blue bars represent influenza death, and the black one represent COVID. So you can see COVID actually caused a much higher death rate than influenza. So up to this morning, about 2.8 million of the population died worldwide because of COVID. In China, the situation is much more contained. About 4,000 people died. In Hong Kong, 205. But in other countries, for example, in the USA, 500,000 has died. Philippines, 13,000. Indonesia, 40,000. and in India, 162,000. So many people died because we lack this immunity against these completely new viruses. This is the data from Hong Kong up till January the 5th of this year. You can see the overall case mortality is about 1.9%. And the chance of death varies according to different age group. If you're at the age of 20, the death rate will be about 0.2%. When you are getting older, the chance of death will be higher and higher. When compared to the age of 20, if you're at the age of 40, you will be 3.5 times higher chance of death when compared to young people. If you're at the age of 60, the chance will be 12-fold higher than the younger population. So age is a very important risk factor for COVID-related death. Apart from age, there are other health conditions that can also increase the chance of death. Is the data from the Chinese Center for CDC. And cardiovascular disease, that means stroke and heart diseases, diabetes, respiratory diseases, hypertension, these chronic illnesses will significantly increase the risk of death after having COVID. So it is why governments recommend people with a stable chronic disease to have the vaccination. And people with these diseases has actually been prioritized to have the vaccine in the Western countries because they are related to a higher chance of death and complications. On the contrary, some people get infected may not have any symptoms. So they are called asymptomatic because they have no symptom at all. It seems that younger people, they will have a higher chance of asymptomatic infection. That means they have the infection, but they don't have the symptoms. And this is why it is very difficult to get rid of this infection because we are not able to identify these people who are infected but without any symptoms. And this is also the reason why we have patients get infected, but they do not know the origins of the infection. How the vaccine works, is it going to be helpful to us? If you look at this coronavirus, the most important part, if you remember, is the spike protein. The spike protein is like the hand of the virus. It grabs on the cell surface, and so the virus can get inside to our body cells. So it is very important for us to train our immune system to recognize these spike proteins. So sometimes we may not need to put the whole virus inside our body for our body to recognize it. We can also put part of it, or we can just put the spike protein part into the body so that our immune system can recognize it and produce antibody against this spike protein. This is how the vaccine works. And if we develop antibody against this spike protein, this virus will be neutralized and the chance of infecting the cell will be much lowered. So this is how vaccine works. There are a number of different types of vaccine, but all of this, it's to inject either the viral particles, the weakened viral particles, or part of it, for example, the spike protein into our body. When these spike protein structures is recognized by immune system, our adaptive immune system will produce antibody against it, remember it. And once the infection gets into our body again, we can act rapidly. Yeah, up to now, there are three types of vaccine for COVID that will be available in Hong Kong soon, or has been available already. The first type is inactivated vaccine. This is the vaccine used for a very long number of years. Influenza vaccine is a very good example that we have been using in past few years. And this is killed virus. This killed virus is injected into our body and recognized by immune system so as to trigger a immune response. Since it is a killed virus, it is not going to cause any illness in our body. The second type of vaccine is called genetic vaccine. Every virus contains genetic material in the center of the viral particle. And this either DNA or RNA. The scientists take part of this genetic material. For example, in coronavirus is RNA. We take part of it and put it into our body. This RNA will instruct our body cells to produce spike protein. It is the most important structures of the coronavirus. When the body recognizes this spike protein, it can produce antibody against it, so as to trigger an immune response to protect you against the COVID infection. The third vaccine is called a viral vector vaccine. It makes use of a rhinovirus to contain the genetic material. It's just like it's called viral vector. It's just like a car, a vehicle. They will transport the genetic material from outside of the body to inside of the body. Once the genetic material go inside the body, it will go out of the vehicle, instruct our body cell to produce spike protein. And this viral vector that we've been using is called rhinovirus. This virus is a very common virus that causes common cold. So people will make use of this virus to help this genetic material to go inside the body easily. This virus is not going to infect our body because it is specially designed. When it's finished its job, it will be denatured and being get rid of our body. So it is considered to be a safe way of carrying the genetic material inside our body. So all these three vaccines is considered to be safe. I mean, it will not cause infection of the body. Many people think that this vaccine will cause infection, but it is not. It is either an inactivated viral particles, or it is just part of the virus, namely the mRNA and the spike protein. So it is not going to cause a genuine infection in our body, but it can let our body recognize the COVID virus so that we can produce antibody against it. Some people ask whether this vaccine development is too fast to be safe. And if we look at the development, we'll know that every new drugs will go through several very important steps before it is eventually being marketed and used in our daily life. So if you look at other vaccine, usually it will go through a number of development phase, phase 1, phase 2, and phase 3 trial. Usually these trial will take a number of years. But for COVID vaccine, for development of COVID vaccine, because it is a global crisis, all the government put a lot of money in the development of this vaccine, and it is a very coordinated development. So usually a vaccine takes about 10 years to develop, but for COVID, it only takes 1 to 2 years. So if you look at the development of this COVID vaccine, I think they have go through all of these important steps. They have not missed any one of it, but it is just that people going through all these steps in a very short period of time. So how effective is this vaccine? We'll have some brief discussion on the two vaccines that is now available in Hong Kong. The first is Pfizer-BioNTech, and the data is there. It has gone through a phase 3 clinical trial. If you look at the phase 3 trial, a total number of over 4,000 participants has undergo randomization and evaluation. They basically compare two groups of people. One group received the vaccination and the other group do not receive the vaccination. They just receive placebo. And so they compare. They compare the effectiveness between these two groups, and they found that the effectiveness of this vaccine reached 95% in preventing symptomatic COVID-19 infection. So this is a very good figures. And these data was repeated, and another bigger post-licensing trial conducted in Israel. It is a nationwide mass vaccination program, and they actually study over 900,000 people in Israel. And it is found that for the vaccination group, it is 92% effective for documented infection, and it is also 94% effective against symptomatic infection. So the figures is quite comparable to the phase 3 clinical trial I mentioned earlier. How about CoronaVac? CoronaVac in the phase 3 placebo-controlled trial in Brazil, the effectiveness was also confirmed, is reached the WHO criteria for effective vaccine. The effectiveness was up to 50.65%. And it is also reported that for severe cases, the vaccine efficacy was up to 100%. Although according to the data published by the government, for the very severe cases, it seems the confidence interval has not been reached, probably because of the small number of severe cases. But based on this data, CoronaVac is a safe and effective vaccine for the COVID infection. And there is also a subgroup analysis on the effectiveness on the different age. For people aged between 18 to 59 years old, the efficacy is 50.66%. And for those who are above the age of 60, the percentage is up to 51%. So this is how we have been doing in the world. These compare the effectiveness of various COVID vaccine, and the two vaccines available in Hong Kong, it's the Pfizer-BioNTech and the CoronaVac, and the one which will be coming to Hong Kong very soon is the Oxford's AstraZeneca. So the efficacy is up to about 70%. And this is how Israel has been doing very good. They have is one of the very few countries that has have an early rollout of the vaccination program. It started its vaccination program in December last year, and they started to inject those with high risk first. That means those elderly patients at the age of 60 or above will have the vaccination first. So if you look at this graph, you know that those who have the vaccination after the second dose, those who have the vaccination, those who are at the age of 60, the number of cases confirmed of COVID drops significantly after the second dose of the vaccine. And it is also the case for hospital admission. Those who have received the vaccination, those who are at the age of 60 or above, the hospital admission rate drops significantly compared to those who have not received the vaccination, because they are at a low risk. They have not received the vaccination at the early phase of the program. So you can see the effectiveness of vaccine is confirmed in this study. And how about the situation in the UK? This is the data from the UK. As you can see, after the rollout of the vaccination program, the death rates drops significantly, not only in the elderly group, but also in the younger population. And they're showing that the vaccination does work. This is also the case in the US. The situation in the US is quite of a problem in January, but after the rollout of the vaccination program, it seems the number of cases confirmed every day drops significantly. So how about the safety of the vaccination? The safety of the vaccine has been shown in large clinical trial. It has shown to be safe, but the most significant side effect could be injection site reaction. It is the data from Nature. It reports the more common reaction to the Pfizer-BioNTech vaccination. And the most common side effect would be pain, fatigue, headache, muscle pain, and fever. And these side effects will last for less than a week for most patients. And it is found that for those who have more significant reaction, the immune response to the COVID is higher. So it may not be too bad if you have a significant injection reaction. And some people may have some concern about the death related to the Pfizer vaccine. It has been reported that 23 deaths in Norway was related to this vaccination. But it is found that these 23 elderly patients are very old patients. They are bedbound and they are fit on rice tube. And even very mild vaccine reaction will cause death. For example, some patients after the vaccination will have vomiting, diarrhea, and some systemic upset. For this 23 frail lady, even the vaccine reaction is not that significant for young people, but for elderly lady, it will cause some mortality. So the WHO advisory board has investigated seriously in these 23 cases, and the conclusion is that this death is not directly related to vaccination. So why do we think that vaccine will cause mortality? So whenever a vaccine was rolled out, and people will look at each death cases very carefully. So say, for example, in April, the government started a vaccination program. And after the vaccination, they have reported 6 cases of death. So people are very worried about this death, whether or not this is related to the vaccine or not. But we look at it very carefully. Even before the rollout of the vaccination program in March, they have already been 6 deaths in the population. So it seems before and after the vaccination, the number of deaths is just the same. The number of deaths before the vaccination is 6 per month. And after the vaccination, the number of deaths is also 6 per month. So if we look at it more scientifically, we need to calculate the number of deaths before and after vaccination. The vaccine has been used globally for 6 months already. So we have collected a lot of data about the death and side effects related to this vaccine. And it seems if you compare the death rates and the complication rates before and after vaccination, they're quite comparable. So the experts can conclude that the vaccination is considered to be safe. So people also look at, if you look at the death rates of Hong Kong, every day we have 133 deaths. Every day is the data last year from the Hong Kong government. And 17 people die of heart attack and 8 people die of stroke every day. So if we can prove that after the vaccination program, the number of deaths, the number of heart attack and stroke is similar to before the vaccination, then we can conclude that the vaccine is safe. And these deaths related to heart attack and stroke might not be related to the vaccine. So we'll need to wait for more data in Hong Kong, but from the data abroad, because the vaccine has been used for a very long time, hundreds of millions of people has get vaccinated in other countries, we can make use of this data and look at the true risk of death related to this vaccine. And I think after I look at the data, the vaccine is considered to be quite safe. If you're interested, you can also look at the adverse event reporting system. There are different reporting systems across the countries. This is one of the system they can check. It is from the US. This is called a Vaccine Adverse Event Reporting Program. It will record all the adverse reaction reported by the patients, and the experts will analyze whether this adverse reaction and death is related to vaccine or not. So from a data published in December last year, it reports one of the most important and severe complication related to the vaccine. It is allergic reaction. The most important adverse effects of vaccine is anaphylaxis. Is the most important, it's most severe types of allergic reaction, resulting and could possibly result in death. As of December last year, there are reports of 1 million of adverse effects related to Pfizer vaccine, and 21 cases was eventually determined to be anaphylaxis, the most severe type of allergic reaction. And they calculated the absolute risk of this anaphylaxis. It's 1.1 per million doses administered. And for these 21 cases, 20 persons has been able to be followed up, and or even they develop such severe anaphylactic reaction or recovered and can be discharged home. So, the vaccine is now given in a designated center, usually in clinic or in hospital. And people, if you develop such anaphylactic reaction, you could be recognized and appropriate treatment could be given. The mean interval of development of this anaphylaxis in this study is about 30 minutes. So if you wait for 30 minutes after the injection, it will be relatively safe for you to live, because most of these very severe allergic reaction develop quite rapidly after the injection. And for CoronaVac, from newspaper, you notice that 44 million doses has been given worldwide, and the number of deaths is not very much. It's only about 56 deaths, and the death related to this CoronaVac is really low. So it's considered to be a very safe vaccination to be used. People also talk about other rarer complication after vaccination. For example, Guillain-Barré syndrome. Guillain-Barré syndrome is a neurological disease which will cause weakness of the body. But it seems the number of GBS related to this vaccine is not increased if you compare to the sporadic cases annually before the vaccination. So it may not be a real problem related to the vaccine. So if you compare to the flu vaccine we have been using in past decades, the chance of having side effects is, of course, a little bit higher. The Pfizer vaccine will cause a systemic reaction in about 75% of the participants, but this reaction is not very severe. It's mainly headache, muscle ache, fever, and chills. For flu vaccine, this systemic reaction is lower. It's only about 34%. Although the chance having this systemic reaction is higher than flu vaccine, this reaction is self-limiting. It is not too severe, and it goes away in a number of days. So even if you develop this systemic reaction, it seems it is quite tolerable. There has been rumors that people having chronic illnesses may not be suitable for having the vaccination. If you look at the previous slides, you notice that those patients who have underlying health condition, for example, diabetes, obesity, hypertension, and other chronic illnesses that affect the organ function, this group of population will have much higher risk of death and complication. And this is the reason why the government in the US and in the UK will prioritize these patients to have the vaccination first. From these data, it seems that those patients who have chronic illnesses, for those elderly who have these different chronic conditions, the chance of having side effects is not higher than other people. So if your chronic disease is under good control, it is safe to have the vaccine. And in fact, because of the high risk of having complication, people with chronic illnesses, people with advanced age are recommended to have the vaccination. This is the recommendation from the Singapore government. And for in the country, those who have diabetes, high cholesterol, hypertension, asthma, all sort of these chronic conditions, if they're under good control, they can receive the vaccination safely. The exception is that when they have anaphylaxis and when they have history of very severe allergy, not the usual skin allergy, but very severe type of allergy, they are advised to have the vaccination very carefully and may consider alternative. Those patients who have weakened immune system, for example, those who have organ transplants, they have to take immunosuppressant, or my patients who have rheumatoid arthritis, they need to take high dose steroid. In that case, it is the effectiveness of the vaccine is not proven. If you are taking very high dose immunosuppressants, it may still be safe to take the vaccine, but effectiveness may be affected. So you need to discuss this with your in charge physician first. And for those who have very low platelet count, issue is that you have bleeding more easily than other people after having a needle injection. So it has to be carefully handled. Otherwise, all other chronic health conditions should have no problem having the vaccination. And this is the prioritization table for those patients in the UK. As you can see, those patients who are at the age of 65 or above, those healthcare workers and those with disability and chronic illnesses may have the vaccination first. How about the situation globally? Hong Kong has the rollout of the vaccination program already, but it seems it is not the case in other countries. It's more readily available in those richer countries, for example, in Europe and in North America. But in most parts of the world, for example, in Africa and Middle East, the vaccine is still quite not available in these regions of the world. And it is estimated that Hong Kong is lucky we can have our vaccination now, but in some parts of the world, the vaccination program can only be started in early 2023. For example, those countries in Africa and some countries in the Middle East, they are not that lucky to have the vaccination early. So we are blessed that we have the vaccination in Hong Kong so that we can choose. So that's what I want to share with you about COVID and the COVID vaccination. And you're very welcome to ask questions. Now let me look at the question that you ask. So the first question is it okay to have the vaccination if you have acid reflux recently? It is okay. It's okay. The vaccine theoretically will not affect your acid reflux. Although those patients who consider having the Pfizer vaccine will have GI upset, stomach upset more easily than other people, but the chance is not very high. And this GI upset will go away in a couple of days. So having acid reflux is okay to have the vaccine, the COVID vaccine. And the second question is about for those with hypertension. Yes, this is a very common question to ask because the government says those who have chronic illness, for example, hypertension, has to use the vaccines very carefully. Yes, if you have very severe uncontrolled hypertension, you're recommended to have treatment for the hypertension first. In fact, but hypertension itself is not a contraindication, is not a problem of having the COVID vaccine. So if you have hypertension, and if the hypertension is under control, that means that you have been taking drugs to control your blood pressure and the blood pressure is not very high, it is okay for you to have the vaccination safely. And number 3, it asks for a patient who have medicine and food allergy. Is it okay to have the COVID vaccine? Yes, the major risk of the COVID vaccine is allergy. If you have multiple allergy, and if the allergy is quite severe, you are advised to ask your doctor first. But if the allergy is not very severe, just mild rash, just mild food allergy, I think it's still okay to have the COVID vaccine. The chance of having allergy, it seems, is higher in Pfizer vaccine. So if you have severe allergy, histories of severe allergy, you may consider to have the Coronavac. And the next question is about, does it have to get flu and pneumonia vaccine, pneumococcal vaccination, I mean? Yes, it is useful to have this vaccination, especially you are having chronic illnesses. For my patients who have rheumatological diseases, who have chronic illnesses, I advise them to take flu vaccine every year. And for those having high risk or elderly patients, I also recommend them to have the pneumococcal vaccine. But flu vaccine and pneumococcal vaccine is not effective against COVID. So if you want to protect yourself against COVID, flu vaccine and pneumococcal vaccine is not enough. So you have to have the COVID vaccine separately. And if you consider to have the vaccine, you have to do it separately. You are not advised to do it all together. So since you're now in the pandemic, if you want to have the vaccine, you should consider having the COVID vaccine first before having the other vaccination. Number 5, is BioNTech okay for people with diabetes? Yes, it is a very commonly asked and important question. Yes, all patients with diabetes can receive Pfizer BioNTech vaccine. People in the West, in the UK, and in the US has received millions of doses of Pfizer BioNTech vaccine. That will also include participants with hypertension, diabetes, and chronic illnesses. It seems they are okay. After the vaccination, they have not developed complications. So if you have diabetes, it is okay to have the vaccination. Only for those who are having uncontrolled diabetes, I mean, if you have very high blood glucose, despite of drug that you have been taking, you are advised to ask your doctors to adjust the medication first. Otherwise, it is not a contraindication to the BioNTech vaccination. Question number 6, if one needs to take regular medication for hypertension or other illness, it is safe to take the vaccine directly, or do they need to seek doctor's approval first? The problem is, if you are having a stable condition, if your hypertension is under good control, if your diabetes is under good control, it is okay for you to have the vaccination, or despite you have to take regular medication. You're advised to continue to take this medication while you have the vaccination. It is not going to cause interaction with the vaccine. So it is safe for you to take this medication while you have the vaccination. The only exception is those patients who are taking immunosuppressants, for example, high-dose steroid, or those patients who need to take drugs to suppress immune system. For example, those transplant patients, they need to take immunosuppressant to avoid transplant reaction. There is some issue. It is not a safety issue, but these immunosuppressants and steroid will reduce the effectiveness of the vaccine. So if you are taking these sort of drugs, your physicians may give you some advice as to adjust the dosage of the drugs so as to boost up the effectiveness of the vaccine. But it's not going to affect the safety. So if you are taking this drug and have the vaccination at the same time, it is safe. If you need to take this drug and you're not able to stop it, you can just continue this drug while you're having the vaccination. So I hope I can answer the questions and is your worries about the vaccination. I myself had the vaccination last week, and I think the vaccine is not causing a big problem to me. And I'm going to have the second vaccination very soon next week. So if you have further questions, you're always welcome to ask.
Thank you very much, Dr. Yu, for the excellent talk. I have learned a lot from you as well. And I'm sure this talk will help us to decide, is the vaccine good for us or not? Shall we take it or not? So if there are no more questions at the moment, maybe we'll call it a day here. And thank you again to Dr. Yu for your time. Thank you very much.
Thank you. Have a nice Sunday.
Thank you. So now I would like to share a photo of Hong Kong Women Doctors Association before we end the meeting. So the YouTube live will continue. And you may leave the YouTube live at the moment. Thank you, and we look forward to see you again.